Good day. My name is Akinlaja Ogunsoya. I'm making a PowerPoint presentation on drug addiction. It's a project that I had embarked upon with my partner, Mr. Daniel Chukwude Unwosa. Please join me as I make my part of the presentation. My presentation starts with the diagnosis of drug addiction. Drug addiction is a chronic condition that is difficult to diagnose and treat. However, diagnosis diagnosis first rely on the person with an addiction or close family acknowledging and wanting to address the problem. Medical professionals often use the criteria of the Diagnosis and Statistical Manual of Mental Disorder, popularly called the DSM-5. Diagnosis of drug addiction requires the following: that the patient demonstrate two or more of DSM criteria, thorough evaluation and assessment by a psychiatrist or a psychologist. Blood, urine, and other lab tests are used to assess the drug use. Treatment of drug addiction. Drug addiction has no cure. However, there are different treatment options available to the patient. Treatment, however, depends on the drug use and any related medical or mental health disorder the patient has. Treatment may include chemical dependence treatment, individual, group, or family therapy session, and then focus on understanding the nature of the addiction. Then the other kind of treatment is detoxification. This is to enable a patient stop taking the addicting drug as quickly and as safely as possible. This often requires the patient admission. Then behavioral therapy. This is a form of therapy. This is a form of psychotherapy that can be done by a psychiatrist or a psychologist, or a psychologist or a licensed counselor. This may be done as an individual, a family. This can be done as an individual, family, or group. The therapist can help develop ways of coping with craving, suggest strategies to avoid drug and avoid relapse, offer suggestion on how to deal with relapse if it occurs. It also includes family members to help develop better communication skill and be supportive, and also to address other mental health conditions. Self-help group. Self-help support group message is that addiction is a chronic disorder with a danger of relapse. Self-help support group can decrease the sense of shame and isolation that can lead to relapse. The other option also is medication. Medication and devices can be used to manage withdrawal symptoms, prevent relapse, and treat co-occurring condition. Exercise is also can also be used. Exercise generally decreases the reinforcing effect of drug abuse, but its efficacy is variable. Exercise may prevent drug use initiation through interaction with dopamine in the reward pathway. Exercise also may also prevent through interaction with glutamate, dopamine, and chromatin. In conclusion, drug addiction is a menace to the society. Therefore, every measure possible must be taken to avoid discord. Governments, social organizations, the media, religious organizations, and educational institutions must work together to protect and preserve the nation's human resource and health from the immense danger, immense destructive capacity of drugs and drug addiction. Thank you, and that is the conclusion of our presentation.